Hi, I'm Dr. Dhanvanti, and you are watching Anatomy of Bias.
I saw this patient about 3 years ago, and she came in to see me with a lot of body pain. And she said that her arms hurt, her legs hurt, her head hurt, and that she was tired all the time. That's the primary thing that she came in and said to me.
Was the patient's family or the patient herself able to recognize that their symptoms were actually belying a much larger problem or a mental health issue?
No, no, no. So this was a classic thing that I've seen in our country over the years of women, especially coming in with body pain and headaches. And eventually, when you prod and ask a little bit more, yeah, she said yes. I have not been sleeping well. I am more cranky with the children. I shout at them a lot more. I don't have an appetite. I have no time or the energy to eat. So eventually, after me prodding, she came out with these extra bits of information, which was critical to the whole picture of what was going on with her.
Okay. What was there a trigger preceding this event and these symptoms?
So the thing was that she had a baby. So she said that all of this started after the birth of her baby. And I said, "Acha, kya hua tha?" Like, what happened when you had the first baby? She said, I did not feel the bonding with the child. I did not feel excited that I had a baby, and that it should have been a good moment for me. Nothing like that was the case. I was only tired all the time, doctor. I did not the idea that I had to breastfeed the child, that was itself exhausting to me. I didn't want that child next to me. The baby crying irritated me. This happened to her the first time, and then she said it happened to her the couple of next times also. It happened the second time also. Uh, and that it was considered, a part of hormones, and that she had a child, and it was normal for a woman to be tired.
Absolutely. So there was very little recognition from people around her that she probably had postpartum depression or something more serious and organically happening with her.
That's right. So there was no concept, I don't think, in the family that there was something actually diagnostic or what one would call an illness with her. Everyone just assumed that this happens to every woman. You'll get over it. There is nothing to do.
What made the patient come to you for help? How come she didn't just reach out to her gynecologist or a physician to say that I'm always tired? Who incited her to seek help from a professional, from a mental health professional, and realize that there is something bigger happening inside of her?
I think the big thing, as I've seen in not only this young lady's life, but in many young women's life, is that she reached a point where she was not functional. She reached a point where she wouldn't even get out of bed to make the nashta in the morning, the breakfast in the morning. She was not taking care of the children as even so-called quote unquote expected, but even her own standards she was not meeting. And then eventually, I think by the time they came to me, it had reached a point where she was saying, "There's no point in living. I'm a terrible mother. I'm a terrible wife. I'm not a good daughter-in-law. I'm not doing a good job at anything. So I think I think I should die." And there was a lot of conversation about that. For the time her husband would have to come and talk to her. So when he did, in fact, even have some time to spend with her, she would say, "There's no point," and express hopelessness and being a worthless woman.
So she felt worthless as a mother, as a daughter in law, as a wife. So, was there a long span of time that she held back from seeking medical treatment? What was the duration of time?
I'm forgetting the exact dates now, but by the time she sought treatment, at least it was an average 6 years about. So this had been spiraling on and on and on over a really long time before she sought help.
Okay. And what do you think this bias against medical treatment for mental health issues, where does it come from? Why was she not prompted to take help before she reached such a point of absolute desolation?
I think the recognition was not there. It wasn't looked at as a medical condition. It was looked as more an impediment to the normal functioning of the house that even brought her to me. Even by the time they came to me, um, it was some friend's suggestion to her husband that in such cases you should see these doctors that treat these people who are like this.
Right. So there was very little social awareness that she was actually struggling, and it wasn't her struggle that made them bring her to you. It was the inconvenience caused to them that made them bring her to you.
Pretty much.
The social bias from the husband as well as the in-laws, because it was one thing for you to diagnose it and give the patient insight into herself, but to convince the rest of the family that this was something that required treatment. How did you manage to overcome that?
So I think I kind of focus more on the husband, because once I told him that, listen, this is not her trying to be difficult or trying to be what might be considered lazy. This is somebody who's actually struggling to push herself. As you would say if you broke your leg, or as you would if you had a headache. It's so hard to get out of the bed if you have a headache, or it's very hard to move if you sprained your ankle or broken your leg. And so she's not trying to be the way she is. She is this way because she's got a medical condition. We can treat this. I always put that up front, that there is a reason it is this way, and let's get her out of this situation.